Welcome to RevMD Sex Bites Podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Faraday Golombieski, nurse practitioner here at RevitalyzeMD. And today we're doing a podcast on low sexual desire in women.
What percentage of women actually have a low sex drive and low sex desire? So we're going to find that out. So really overall, they're kind of talking about like a 1 in 10. But we kind of disagree with that because we see and hear that a lot. So what it actually comes down to is 1 in 10 or 10% would be like an actual diagnosis from a doctor, and it's much higher for women actually having a low sex drive. And so there is a code, and it's hsdd, or hypoactive sexual desire disorder for women.
Yes, that is actually a diagnosis through the DSM-5. So you have gone and have been clinically diagnosed. So there is they go over your sexual history. You do a questionnaire in which you answer questions based on how you score on that and your history. That's how you are actually diagnosed with hsdd. So that is very different than someone who has a symptom of low desire. Mm-hmm. Doesn't mean that you don't have it. It just means you haven't taken that extra step to be diagnosed with.
And it really takes like two parts. It is a questionnaire, which we'll talk about, but it's really low sex desire and being distressed by it or psychologically affected by it, emotionally affected by it.
Yes.
So the female sexual function index, which is the test that they give you to measure this, is actually 19 questions, 6 different areas, and it's a score of 2 to 36. And so when we do this, like with a sexual function for men, it's a score of, a 5 to 25. So this one is similar, 2 to 36. And so you're going to take that test to get a diagnosis that's going to be part of it. And so it actually talks about it in terms of, your desire, your arousal, your lubrication, even your orgasmic strength. So it's 6 different parts to it. You get a final score, and then, again, the actual diagnosis is a lot less common than the low sex drive.
I would have guessed that percentage a lot higher just based on the patients we see here.
Yes, no.
The majority, I'd say, if they're coming in for hormones or sexual wellness, I'd say probably 90% of them have low libido, low desire as a symptom. So I would have expected this number to be a lot higher than 10%.
So it also depends, I think, and that is actually desire, arousal, lubrication, orgasm, and satisfaction and pain. Those are the 6 different areas. I couldn't remember those last couple ones. But I think that we see it every day. But it's either very distressing to a woman, and that's one of her primary reasons, or there's a lot of other things. It's there, but it's not the
main reason they walked in the door.
Correct.
But it seems to always kind of be on that checked box.
It's on the box. It's checked off. It's on the list for sure. But some of them, either like it could be that their partner's drive is not that high either. And now they're kind of getting used to it, which actually brings us to some good points with this. When we talk about low sex desire, about a quarter of premenopausal women have a low sex drive. And again, the actual diagnosis was at about 10%. But when you look at naturally menopausal women, so women that just go through the change in life naturally but don't have any surgery, it's about half.
Yes.
But then it's much, much higher in women that have had surgical menopause. So they have actually had their ovaries and uterus removed, or they have had surgery. And what's really bizarre is, again, that puts them at a much higher risk for being emotionally affected by it too. So having the diagnosis of hsdd. So the younger surgical menopausal patient has a much higher risk for psych issues and for low sex desire. And so I think that needs to be more commonly brought to a woman's attention when somebody's talking about taking out their uterus and ovaries.
It should always be part of the discussion.
Because even once we start to really deep dive into a topic and start to look at studies, again, it's those numbers that are like shocking sometimes.
Absolutely.
And you have some really good numbers too. But again, that's like the highest risk is the younger woman. So the younger you are, because I think that, again, low sex desire is something that commonly is experienced with age, especially with
the
usual
misconception.
traditional medicine. It is, and it's accepted that like that just happens, and it does for hormonal decline. But then again, they start to get less bothered by it as we age too, because again, they're just used to it and they've given no solution. So we've kind of gotten used to it. And so, that's a also distressing fact that we don't seem to care. The further on we are without sex drive, the less we care about it. And that doesn't have to be the case. We can still have sex until we
there's treatments.
Yes.
And that's a lot of what this podcast is about, to educate patients, to educate people out there that want to know about solutions. One of the studies I came across said only 14% of the women that they polled, it was over 2,700 women, only 14% knew that there was an option for them for treatment, or that there was even anything out there for them. It means the rest of those women have just been living with these symptoms at whatever range of distress, right? Whether it is an issue in their relationship, whether it's something that they're unhappy about, or if they have significant distress over it, where it's led to depression or other mental health issues. But out of all these women, only 14% knew, I could probably talk to my doctor about this and they'd have a solution of some sort for me.
And I think that is so underestimated. And I know you agree with that.
Yeah.
I mean, we see women all day long. Like, we see a lot of women and hormone replacement with women. And it's because these women are also more proactive in this area than providers are. And we hear it every single day and many times during the day. So this isn't one day. This isn't one patient. This is two of us seeing patients, and we hear it multiple times in a given day, and that's all week long. So that low sex drive is there. We're feeling symptoms of aging, and our traditional doctors, whether they're gynecologists or primary care doctors, have given no solutions, and they're tearful by the time they come, and they're extremely tearful because they know somebody's listening to them for the first time, because that is normal, but there's solutions for it. And so I feel like that's so underestimated, that 14% are seeking treatment. Like, I feel like it's probably, so when they poll even for low sex drive, and it's a quarter of women or half of menopausal, I would say that it's like, again, on the list in the checkoff box for almost every menopausal and even premenopausal woman we see, it's an exception rather than the rule, that the premenopausal or perimenopause woman doesn't have some lowering of their sex drive.
Absolutely. And what's interesting is that when you're looking at these, this national survey, it's a national survey looking at women from the ages of 21 to 49. So, looking at that younger woman. Yeah. No, I do think that, again, where do they have those conversations? So who's asking? Who are they polling? Who are they sending it to? But also, who's asking to find out, that there's, a low sex drive in anyone? Because the last time I've heard anyone say that the doctor had a questionnaire, or it was an open conversation that was initiated by the doctor. My primary never asked me.
Yeah, your what?
My primary's never asked me.
No, exactly. I thought you were saying.
I was like, my primary's never asked me.
Like, your primary asked you? I'm surprised. So,
no, never.
No.
Has your primary ever asked you?
No. The gynecologist has never asked. Yeah. Never once have I ever been asked. We have an intake form. And again, I think that if you're coming in and that is not the concern, but because that's such a common complaint, even if they come in complaining of energy or, weight gain or brain fog, that we have a questionnaire that talks about, why are you having sex? Is it like you for your partner? Like, it has multiple different answers, but also like orgasms and what type and strength and, lubrication and pain. And so it asks about all those questions. And women don't have a lot of options or places to go when they want to have conversations about a change in their sex drive. So who's asking those questions to actually find out who has a low sex drive?
Because when we look at those surveys, again, 77% of women think that we need to have more open conversations. It needs to be in the media. It needs to be talked about. 81% of women are having sex with a partner even though they're not in the mood, because 46% think it's putting their relationship at risk if they don't.
Yes.
Yeah. So there's options.
Well, that's one of the reasons why we ask. So one of the reasons on our intake form is, again, we can compile data over time, is that what reason, why do you have sex?
Why?
Is it because you want to have sex? Is it because your partner? Is it because you feel obligated? Not because we're trying to say anything negative about the partnership or relationship, but also because, like, this is important. The psychological reason behind why we're having it. And there's a book, Why Women Have Sex. It's a whole nother, topic for another day, but it matters. So, and we're just not having. So I love the fact that like 70% of women polled, say we should have more open conversations because we absolutely should. Yeah, no, I agree.
It's what I'm seeing in practice is the younger generation is seeking out treatment. They're seeking out answers and they have questions, where the older generation has a lot of times it's just their moms didn't talk about it. Their grandmothers didn't talk about it. It just wasn't discussed. It was taboo to talk about any of this stuff. So you just put up and shut up.
Yeah.
And you move on with life. Yeah. You go through it.
No pun intended.
Yeah, right? But we're seeing this shift, which is pretty cool. So when you see 77% of women want the conversations, someone's got to have them.
Yes.
That's why there's clinics like ours.
They need a place to go, and they're extremely happy for it. I love your, so as we do some research, we're always looking at different areas of it and bringing it together. And it's interesting, our conversations even before, but shocking numbers again.
Yeah. So where we think sometimes a podcast is going to go will shift based on studies or discussions. So in one of the studies from 2021, so this is a recent study, that it said that among women with depression, so your risk of sexual dysfunction is increased by 50 to 70%. So you have an increased risk of sexual dysfunction, 50 to 70% among women with depression.
And I would say that too, before we even go to the other shocking fact,
it's huge.
Is that meds? Is it just the psych? Because again, your sex drive will decrease with some psychiatric meds, and it's nothing that we ever recommend anyone come off of, but sometimes it's something that we could potentially adjust or address with the primary care doctors once we get them feeling better.
Exactly.
So that's just with depression.
Huge.
Yeah.
That's 50 to 70% increase, right? So that's huge. But inversely, so this is what kind of blew our mind, is that women with sexual dysfunction, so not depression, sexual dysfunction diagnosed, have a 130% to 210% increased risk for depression. Think about that. 130 to 210% risk for depression. That is huge. That tells you that women are bothered by this. Just like men are bothered by not having erections, women are bothered by this. It can affect all aspects of life, and it leads to these high risks.
Well, and we're talking about hypoactive sexual desire disorder and a diagnosis. And so when we look at that, so again, they were talking about if that's low sex drive too. So really when it comes to sexual dysfunction, or when it comes to hypoactive sexual desire disorder, it's just one of the sexual dysfunctions women can have. So you're talking about low sex drive. That's one. Low arousal, low orgasmic
disorder. So no orgasms.
Yeah. I mean, so pain with sex. Yeah. So, which is why that's on the questionnaire. So sexual dysfunction for women is huge. It's anywhere from low, sex drive to pain with sex, with lots of things in between.
Exactly.
And so the fact that somebody has a complaint of that in their primary care doctor's office or their gynecologist, and they're met with there's no solutions, that's something that happens when you get older, and they have an almost up to 200% increase in depression, that's an issue that we need to address both publicly and in the medical community in general. So
that's huge.
That's huge.
It's either, what I hear in office is, I felt like I wasn't listened to, and so I'm seeking options and I'm doing my own research, and that's how I got here.
Proactivity.
Yeah. Or I was given an antidepressant, but I'm not a depressed person.
Mm-hmm. Yeah.
And a lot of times when we start looking at hormones and we start kind of deep diving in and looking at the whole person, we start finding other reasons for some of this and we can find solutions together.
Well, and think about it again, this started way back with Suzanne Summers bringing it to like the main, you
got to bring in Suzanne Summers.
You got to bring in Suzanne Summers way back. This is what she talked about again, like as she's starting to experience, and you have to give her like kudos for her for bringing it to public attention and to forcing some of the medical community willing to step out of traditional medicine to actually learn more about it. Is that, you know, as we hit perimenopause and menopause and we can't sleep and our mood isn't as good and we're moody and we really what we need is hormones. And what are we given? We're giving antidepressants, anti-anxiety, and sleep medicine. And that's not what we become deficient in. We become deficient in our hormones as we get older.
In that same study, it talked a lot about hormones. It said screening for, are we on birth control pills? Because that can adversely affect our hormones.
Yeah.
What are our testosterone levels? What is our total testosterone, our free testosterone, our sex hormone binding? What are these levels and what role are they playing in this? And because those are things we can replace.
Yes.
Yeah, those are things that we can fix. So it's very interesting to see that discussed so openly in a study in a positive light because testosterone replacement for women is not FDA approved in this country, but it is in some others.
No, and there's lots of myths of it, and we will address that in another podcast. We already have a lot of podcasts with testosterone in women, but it'll be something that we continue to do podcast and education on. But again, even young, when you're young and you're placed on birth control, that would actually drive down your free testosterone, which is the active testosterone. So, you know, that is a cause for a low sex drive and younger, and, you know, birth control is very common. So,
but we are not telling anyone to come off birth control. We are not telling anyone to come off their antidepressants or any other medication that can contribute to this. This is for education, to have these conversations with your doctor, to look for solutions, to see if there's other options.
Correct. It's all about solutions if it's affecting you, because it doesn't affect everyone, but it can. And if it does, a lot of women start to take that as if it's something with them. And if that's something that you're experiencing and is bothering you and interfering with your life, you need to bring it up with your doctor. And
so definitely looking at some pharmaceutical medications, because there are plenty that can affect sexual desire. So some blood pressure medicine, some antidepressants, like we said, the birth control. Not everyone is affected by that. It is a smaller percentage of women, but those are conversations that should be had.
Absolutely.
So I always kind of like to take a step back and say, we don't want anyone off.
No. I think it's important. Anytime we're talking about, there are definitely side effects and adverse, reactions that you can have to medications. And so when you're having those, low sex drive can be one of them. So just like you would have nausea or something else affiliated with the medication that somebody starts you on, you want to just discuss it with your doctor, make them aware so they can, discuss other options. And so, but I think that it's so important to just know that depression can lead to low sex drive and, a diagnosis of sexual dysfunction in some way, but also you can have depression when you have a low sex drive. And I think that we in traditional medicine need to look at that more specifically. So what else you gave me all kinds of, she went into all kinds of
I did. We went in all things. Yes. And then we talked about causes. So other than medications or hormones, there are other things, stress, right? Job stress, relationship stress, taking care of another loved one, a lack of an emotional connection. So there's a lot of things that can also be adding to low desire or sexual dysfunction for women. So it is not, even childbirth, our hormones fluctuate significantly after having children. So there are a lot of different things that can lead to it. So it is not just an aging. Oh, I thought that's something that happened when I got old. Mm-hmm. It happens at all different stages of life for multiple different reasons. And as women, we internalize a lot of that there's something wrong with us, but it can be external too.
Well, I think that if you have something that is interfering with your quality of life and you're noticing a change, that is a conversation that needs to be had with your doctor. And if you don't, get
or your
this
partner.
Specific, and your partner. But I think if you don't get it addressed and it seems to be low sex drive, and again, another thing is like pelvic floor dysfunction can lead to that.
Endometriosis.
Or vaginal dryness, endometriosis,
fibroid.
anything with pain. So anything that is an issue you're having and leading to potentially interference with your quality of life, including sex drive and connection with partners, it needs to be addressed. And there are solutions for this specific, and there's lots of regenerative procedures we can do as well, but testosterone's key. So again, becoming more mainstream and accepted, lots of support of it, just no FDA approved testosterone in women in the US. That just means there's no formulation that's manufactured as an FDA approved, but compounding pharmacies do allow you the opportunity to, again, customize some testosterone options for women.
Please share, comment below, like, subscribe. We do these videos for you guys, so let us know what you want to talk about.
Definitely, we want any experience that you have with, any, approach of doctors that that have been very promising, and any options we haven't talked about. And there's lots of regenerative stuff too. And we will put a blog on the website. There were so many stats with this one that I think having something up there that you can actually read through is probably very helpful. So again, leave your comments. Let us know what you want to hear more about, because we're willing to deep dive into anything sexual wellness and aesthetics.